for ligaments, better blood perfusion to the tissue, and improvements in that elastic modulus. And this last study demonstrated a decrease in the amount of tendinosis in the tendon. So if we think about just general concepts when treating a tendinosis, whether it's patellar or any form of tendinopathy, so the first most important thing we need to do is identify the stage of the condition. Is it in the reactive stage? Is it in a kind of a non-reactive stage? It's all about managing load. So in the short term, we need to remove the abusive load, looking at either intrinsic or extrinsic factors that may be responsible for putting an abusive load on that tendon. You know, is the athlete playing on too hard of a surface? Are they overtraining? Are there intrinsic factors? You know, is there tightness maybe in the quads or the hamstrings? You know, is something not strong enough? Maybe the hip abductors are not strong enough and maybe creating a valgus force on the knee, causing that tissue to break down. So, you know, we need to manage load. And then we certainly need to look at pain management. But then our long-term goal is really to improve the capacity of that tendon and muscle to handle that load. So when looking at the stage of the condition, we have to determine, okay, is it irritable pain or stable pain? So irritable pain, typically is something that lasts for several days. So, you know, it may not always be painful, but if there is a flare-up, typically that flare-up lasts for several days. The current theory is that it's the tenocytes that are causing that pain, those overactive tenocytes that are kind of producing collagen kind of in a random pattern, kind of stimulating that scar tissue formation. Again, those tenocytes are being overactive, that angiofibroblastic proliferation. Now, we're going to treat that condition like a tendinitis. So we will look at maybe rest.
Okay, cool. So with regards to the assessment, when I was preparing this PowerPoint, I was collaborating with one of my other GT instructors that I hold in high regard. And she said to me, hey, listen, are you sure that everyone on your webinar who's going to watch you do things to improve mobility, are you sure that all the people on the webinar feel confident that they can identify people with mobility problems? And I was like, I mean, yeah. And then she and I had this really interesting conversation that sometimes we see fellow colleagues working with patients who say they have, I don't know, let's say tight hamstrings. And the truth is that the hamstrings are not independently tight, but sometimes the hamstrings are tightening, right? As a compensation for a lack of core stability. Their hamstrings are sometimes tightening because of a lack of stability or motor control. And so after I spoke with this colleague and putting this PowerPoint together, I said, you know what? I do want to include a couple of slides that just talk about, are we sure we're looking at mobility versus stability? So in our advanced course, we do spend a little time discussing how we determine if a patient is having a mobility or a stability dysfunction. So as I go to do that, I do want to give a quick